I'm Chris Principe. I'm an assistant professor in the School of Business Administration at Niagara University, an AACSB accredited institution. We are very excited about our newest concentration in our MBA program in healthcare administration. Students can complete this concentration in as little as 12 months in our accelerated program. This concentration was developed in close collaboration with regional healthcare executives to ensure relevancy in today's dynamic healthcare environment. I teach 2 courses in this concentration. In my health policy class, we use economic theory to critically evaluate health policy legislation. In my health management course, I use a case-based method to ensure that students possess the fundamental skills necessary to evaluate strategic alternatives in the dynamic healthcare market. This concentration prepares students to lead the transformation of healthcare in their communities.
I picked Niagara because I was pretty familiar with the surroundings. It was a program that I was lobbying that they get 2, maybe 3 years ago before its inception. And once I found out that they did have the healthcare administration program, I immediately went and signed up for that program.
The healthcare industry is constantly changing and evolving, and basically I wanted to make sure that I had the skills and the tools to enhance my leadership skills.
Actually, the schedule is very flexible. I'm in the Saturday program, and for somebody who is working full-time, the flexibility really allows you to capitalize on the program and be able to do the MBA, and that was a big factor in terms of my decision of coming to Niagara University.
The main things that I think Niagara does the best, really well in, is their professors are leaders in their field. They're all top in specifics in economics, or if it's finance, if it's in healthcare. Also, there's the co-op programs, like you can go to Jamaica and work in the hospitals there as an administrator and see things that actually, that help people around the world.
So far I've been through the healthcare classes and they've been fantastic. Christine Principe, she's just a really phenomenal educator, and that has been one of the highlights of the program.
Through the comfort level of the professors and the skills that they provide to the program, I thought that the program, it was very beneficial in terms of the learning experience that I received. The professors really did good in terms of helping me learn the material and excelling in the material.
I'm able to take what I'm learning in class every single day and apply it directly to my work, so that you see results. So that's been a treat.
It was more or less something that I did on my own. I wanted to get into long-term care administration, so I knew at that point, after speaking with our executive director, that a healthcare administration master's degree would help me in getting to that track of becoming a long-term care administrator.
I've always wanted to move into managerial positions, and when I was talking to colleagues and my boss, they were said, an MBA is the way to go if that's what you want. I've been well equipped with the skills that I've gotten from the MBA program.